So in this lecture, mainly you'll have a lot of terminologies, definitions, concepts, yeah, try to understand. So if you have any doubts or any questions, I will push it to the end of the lecture. Yeah, at the end of the lecture, you can raise me question. Or you have questions, try to write it down. So at the end, we can discuss if something is not clear. Um, so first, as we start, yeah, so here we have a definition called as traumatology. Yeah? So what do you mean by traumatology? The definition is straightforward. It came from two words, trauma and logy, a Greek origin. Yeah? Trauma means injury, logy means it's a science. So it is a part of clinical medicine that studies about mechanical injury of musculoskeletal system. Various methods of diagnosis, treatment, and prophylaxis. So here we have the symbol, the one was drawn by Nicola in 1744, and modern symbol of our field of medicine. Yeah, orthopedics. What is orthopedics? So orthopedics, Greek word orthos means straight, ped means child. Yeah, so if you want to define it, is straight child. Yeah, but it is not how it is defined as. Yeah, so it is a section of clinical medicine. That studies about etiology and pathogenesis of diseases of musculoskeletal system, various methods of diagnosis, treatment, and prophylaxis. So this word actually used by Nicola Andre in 1744 when he wrote a monography to address the kindergarten teacher, yeah, telling them, yeah, to maintain the kids in proper posture, yeah, so educate them, yeah, to train them, yeah, to be in proper posture so that they don't have any deformation in the vertebra. So from there it took, yeah. So we can see our field of medicine is making something grow straight, yeah. So or bring something to normal alignment, yeah. So they become an emblem of this field of medicine. When we talk about history of evolution of this field of medicine, yeah, so we can see we have ancient literature, yeah, during Hippocrates period. We have paintings here that talks about that happened in 4th and 3rd BC, yeah, that talks about what happened, various manipulation like reduction of joint, yeah, reduction of fracture. We can find the same period of time. Yeah, there are also um, engravings in vases, yeah, that talks about also reduction and repositioning. Even in the Russian literature, yeah, it is available. Some eminent people in this field of medicine, yeah, you would have studied operative surgery, yeah, or not, you would have came across every time about Pirogov, yeah, and his contribution into this field of medicine, it's huge, yeah. Some of them is being told already. Next, we have Elizarov, yeah, Professor Elizarov, and his introduction, yeah. So he is the one, first of all, yeah, brought very innovative technology. Yeah. This is called as what an extra focal, yeah, external fixator, yeah, ring apparatus. Yeah, it's named after Elizarov, yeah. Very helpful in case of fixing any open fracture, especially comminuted fractures. Yeah, and what happened, especially it is a life-saving thing. Yeah, and this is a limb-saving thing. Yeah, so this introduction was it came in the late early 19th century, but it is very still known wherever you go in the world. Whenever you hear the word Russia, they will always remember this word called as Elizarov. It is after his invention. Nowadays, this device is modified, yeah, used nowadays for cosmetic purposes, especially if people feel they are very short. Yeah, this device is helpful in growing the height of a person. Yeah, so now legend, yeah, one more person, Professor. Yeah, he was before the head of Central Institution of Traumatology and Orthopedics. Yeah, and his contribution into the field of medicine. After we come across few of the history, so here we have some terms and definitions. The first term is used for statistic purpose. It is called traumatism. What is traumatism? It is the totality of trauma repeated in a certain circumstances at identical group of population for a given period of time. This is for statistics. So here, for an example, accident or the reason for death of 3 million people on the date of WHO annually. Yeah? So when we come across as a statistic that what about 3 million people in the world die because of accident, yeah. So what does it do? WHO, yeah, World Health Organization, gives a lot of protocol. Why so many accidents are happening? Yeah. So, for an example, is it because of not safety roads? Yeah. So they will send a lot of norms that road should be like this. Yeah. There should be speed limit. People should have speed breakers. There should be traffic light. Yeah. So So for an example, if it is because of construction work, a building collapse, a lot of death is happening. Once again, they will raise norms so that whatever buildings are built with good quality so that they don't collapse. Yeah. So traumatism gives us data. Yeah, data. Yeah, and it enables the healthcare workers, yeah, especially Ministry of Health, to produce concrete protocol to prevent the traumatism. Yeah. So, for an example, if you take, if you go back in 19th, 18th century and all, a lot of people die in factories because why? They don't have proper personal protective equipments. So nowadays, if you see traumatism in very big industries, it is reduced as minimum as it is maybe 1 or 2% only. Because why? Nowadays, what happened? Personal protective equipment is given in maximum, yeah. Plus, what happened? Wherever they can limit human resource, and wherever they can use computer, yeah. So they use computer and all machineries to prevent accidents, yeah. So this data, this traumatism is a very good statistic information thing, yeah, that can be used very well to analyze and to prevent trauma. So here, this is a statistic from Russia, a kind of traumatism. It's a old one, but it talks about traumatism is divided into two categories: occupational traumatism, yeah, and non-productive traumatism. Yeah, so it only occupies 10% of traumatism. Yeah, the olden time it was agricultural and industrial. Yeah, so 10%. But rest 90% is taken by non-productive. Yeah, so we can see household, street, road, yeah, intentional sports and children's. Yeah, so we can see, yeah, where most of the trauma is happening according to this statistic. Where do you find? According to this statistic, where do you find most of the trauma is happening? This is
Our house.
90%. So yeah, in the house, yeah. So sometimes when you open the door, some pan can fly on your head, maybe, yeah, suddenly knife can fly, yeah. So be careful, yeah. So house is according to this statistic, yeah, we see house is not the safest place, yeah. So very easily fire accident can happen, anything can happen, yeah. So nowadays, what happened? Most of the precautions are taken here to prevent household injuries to the maximum. Yeah, starting by what happened? You can see wherever you live. Yeah, in your apartments nowadays, what happened? Fire alarms are kept. Yeah, smoke detectors are kept. Fire alarms are kept to prevent what happened? Any sort of fire that is happening. Yeah, nowadays people come every time, check electricity, water, everything, yeah, to prevent any traumatism that can happen over here in the house. Yeah, so people are working on it already. Yeah. When we talk about what is this traumatic disease means it's a structural and functional injury to organisms homeostasis. You know you are in homeostasis, but if there is a structural or functional injury to an organism homeostasis, we use the word called as traumatic disease. Yeah, it can be caused by mechanical or combination of other exogenic factor. There is chemical, thermal, radiation. Yeah, that is affecting a person's homeostasis. Next, what is trauma? Trauma is an external factor. Yeah, it can be mechanical, chemical, or thermal. Yeah, external factor that is affecting an organism results in what morphological and functional damage to the tissue that we call it as trauma or injury. A trauma can be of acute or chronic. What is acute? A single stage damage effect of an external factor. That means what happened? You take a chopper, cut your finger. Yeah, it is cut into two half. It is an acute trauma. What is chronic trauma? Damage arising as a result of regular, periodic, and repeated and non-intensive influence of a same injuring agent. Yeah, so for an example, it's very common in sports people. Yeah, they constantly strain their muscles, tendons, and ligaments. Yeah, so the force is not enough for the muscle to rupture or the tendon to rupture. Yeah, but constantly what happened? It gives micro tear a little bit. Yeah, then after that what happened? Maybe inflammatory reaction will happen in the region. Yeah, but it is not damaging. Yeah, but they end up having a chronic pain in the joint maybe. Yeah, or they might have a limitation of movement and so on and so forth. So this is called chronic trauma. So you should be there to differentiate acute from chronic trauma. Next thing, very essential in our field is you should understand if somebody came to hospital with any injury, that is any trauma. Yeah, if someone comes to hospital with any trauma, you have to understand how the person got trauma. So this will be the first question. So patient complains of so on and so forth. Next question you'll be asking, how do you get the trauma? Yeah, so patient can have a trauma because of direct mechanism. Yeah, what is direct mechanism? You see here in the picture, external force act in this part, middle third of the leg, and in that part there is a fracture. This is direct mechanism of trauma. So where the external force impact, exactly, there is a trauma there. Somebody punched you on your face, you get a bruise in the face. Yeah, this is a direct mechanism of trauma. What is indirect mechanism of trauma? External force that we can see over here. Yeah, external force act in one place, distance away from it, you get a trauma. This is a little bit complicated to understand. Yeah, so for an example, if somebody holds a hand and rotates your hand, yeah, so he rotates your hand, you have dislocation of your shoulder. Maybe it is an indirect mechanism of trauma. You jump from height, yeah, you jump from height, landed on your sole of your foot, yeah, you landed on your foot, but you have what, dislocation of hip joint, maybe. Yeah, this is an indirect mechanism of trauma. Or maybe you fall. You're falling from. Somebody pushed you, or you fall from a height, and what happened? You are landing on. You're landing with your hands extended. So your extended hand, yeah. So your palm lies on the ground. Force is being transferred, and you have dislocation of shoulder joint. Yeah, this can be a indirect mechanism. Another example, very first flexion. Yeah, so a decelerating force, you're driving a car, yeah, or maybe you're wearing a seat belt, yeah, sudden brake, maybe, yeah, and you are a little bit prone to osteoporosis, yeah, and because of that, what happens? Sudden flexion of your neck. So you flexed, it can lead to compression of your vertebrae. So this is indirect mechanism of trauma. So what is happening? Force act in a place, that force is being transferred, and distance away from the impact, you have a trauma. This is called indirect mechanism of trauma. I hope you all understood, right? Direct and indirect. Everyone understood, doctors? Hello? Did you all get it?
Yes, sir.
So, very important, one more question. So it can be, why we want to know the mechanism of injury? You see, if patient had external force impacted in this region, for sure I will explore what happened in this region. Yeah, so there can be fracture here in this region. Yeah, sometimes what happened, maybe, yeah, if it was an open injury, yeah, or patient that had a deep wound, maybe I will think about what happened to my TBLS, anterior artery or posterior artery, what happened to the nerve like sciatic nerve, what happened. Yes, so I will inquire in this region what damage can happen, will be there to explore already. In the same way, for an example, patient had, so if direct mechanism where the force act exactly in that place, we are looking for a trauma. If it is an indirect mechanism, I told you, person fell from a height. Yeah, he landed on the sole of his foot. Yeah, you saw maybe there is a penetrating injury. Yeah, there might be a penetrating, there might be fracture in this calcaneus bone. Imagine this, my foot. Yeah, there was a fracture in the calcaneus bone and it was bleeding. You are so busy occupied with your work. Yeah, you didn't even inquire what trauma happened. Yeah, you just saw bleeding. Maybe it is just a wound. You did debridement of wound, suture the wound. Yeah, and maybe you discharge the patient from the hospital. Yeah, because patient pain in the foot is more than pain in any other part of the body. You didn't care. Maybe next time, maybe he will die of some other complication. Yeah, or maybe he will present with some new complications. So what can happen to this patient? Maybe he had fracture of neck of the femur. Yeah, it is an intra-articular fracture. Yeah, pain from the foot transferred along your lower limb. It went, and he had fracture of neck, but you missed your diagnosis. Yeah, so only. Yeah, so it is mandatory to know the mechanism of injury to exclude what complication can develop. So here a few definitions that you can come across almost every day in your practical life. What is bruise? Here in picture you can see a bruise already. Yeah, bruise is a close damage of soft tissue. Yeah, when you have a bruise, it's not going to bleed from here. Yeah, it is a close damage of a soft tissue. Yeah, result from especially what happens, short-term direct impact of a trauma. So it is only the traumatizing force acted on a person only for a short time. Yeah, accompanied with what happened, subcutaneous hemorrhage. Yeah, there will be subcutaneous hemorrhage. That is what you see, this redness. Yeah, and there is no damage to the integrity of the hurted surface. So this is called bruise. So because of microcapillary ruptured in subcutaneous level, you have hyperemia. Yeah, and of course, as the microcapillary is ruptured, yeah, you see signs of inflammation. Yeah, there is edema. If you touch the bruised region, there will be an increase of local temperature and deletion of function. Yeah, so this is bruise. So this is a minor injury. Yeah. Next thing, is called crush. Let's jump to crush. Yeah. So bruise is very mild, but what is crush? Crush is a very serious condition. What happens in crush? There is damage of anatomical and structural integrity of a tissue caused by a direct influencing. So if for an example, your hand was there, a truck went on your hand, what happened? Of course, your hand will be smashed. Yeah, maybe the part of your hand, it was part of your forearm or hand that was smashed, is completely smashed. It'll be like a tomato sauce already, yeah, and you'll have few fingers, yeah, a few nails that is out already, yeah. So what will happen? Crush is a very serious condition of what? Very serious trauma in which what happened? Anatomical and structural integrity of the tissue is completely lost. Yeah, that means what happened in the region where the patient had a crushed injury. Yeah, there is very severe deterioration or deceleration of the blood supply. Next thing is called as crush syndrome. When the crush progresses, it becomes crush syndrome. What is crush syndrome? Yeah, so here in crush, the external object compress the person only for a shorter duration. But if the external object that is compressing the soft tissue, if it is going to be there for much more longer time, more distal to the limb where the crush happened, more distal. Imagine I got crushed in the middle third of the forearm, more distal, that is my palm and my wrist and my hand. There is going to be deceleration of the blood supply, decrease of blood supply. So in this region, more distal to where the crush happened, there will be what? Release of endotoxins here because of ischemia. There will be what? Rhabdomyolysis here. So the moment this compression is being released, this whole endotoxin that is secreted here and myoglobin will get into centralized circulation. It leads to renal failure and further on to multiple organ failure. Yeah, that condition is called as crush syndrome. So we should differentiate what is bruise from crush and crush syndrome. A simple example to explain a bruise: if somebody, if you have a bruised muscle, yeah, somebody punched on the muscle, and then what happened? You took the muscle, yeah, you took the muscle and you examined in the, you examined the muscle in the microscope, yeah. So what you'll be seeing? You'll be seeing muscle fiber with little bit of blood surrounding the muscle fiber, yeah. But if you take a crushed muscle and see in a microscope, you will not differentiate, is it a muscle or what? Because it will be like completely, you might not find where is the blood and where is the muscle, yeah, it will be smashed. So we should differentiate, yeah. Bruise, crush and crush syndrome. Next thing that we can see in elastic tissue, that happens in elastic tissue, is called a sprain. What do you mean by sprain? We can see over here in sprain. Sprain is sprain or rupture. Yeah. So sprain happens to sprain happens to muscles. It can happen to tendons or it can happen to ligaments. Yeah. So what is sprain? It can be a muscle or tendon elastic fiber. If there is a partial tear of it, this is called as sprain. When there is a complete tear, we call it as rupture. So whenever we talk about sprain or rupture, yeah, so it is something that happened to a elastic fiber, that is muscle, tendon, or ligaments. Yeah. So if you take English literature, the sprain is of 3 degrees. First degree is 1/3 of the muscle fiber is lost. Then second degree is 2/3 is lost, and third degree is complete tear. It is called third degree of sprain. Yeah. So I hope you will understand what is sprain. Yeah. So next, rupture. Just now I told you, when complete tear of the elastic tissue, we use the word called as what? Rupture. Or third degree sprain is equal to rupture already. Yeah. So sprain and rupture will happen to elastic tissue. Next thing that we should study is a word called as fracture. A fracture means what? Damage to the integrity of the bone. Fracture happens only to the bone when the continuity of the bone is lost. Yeah, when we can see the continuity of the bone, it is broken. Yeah, so we use the word called as fracture. Fracture will not happen to any other part of the body. It will happen only to the bone. So if there is a fracture, in reference, somebody is talking about injury to the bone. What injury to the bone? Integrity of the bone is lost. Fracture can be open fracture or closed fracture. Yeah, so we talk about open fracture when the skin is damaged. If skin is not damaged in the zone of fracture, here we see skin is not damaged in the zone of fracture, then we can talk about a closed fracture. And next thing that we can see, this condition happens in the joint. What happens in the joint? Yeah, so joint is composed of two articulating surface. Maybe it is a cavity and a head articulating. Yeah, so what is dislocation? In Latin it's luxatio. Yeah, so what is luxation means? Yeah, complete loss of articulation. So if you take a joint, the articulating surface is completely disconnected. So we use the word complete loss of articulation is called as dislocation or luxation. Next, when there is a partial loss, you can see it was like this before, it partially came out the joint. Yeah, so we call it as subluxation. So dislocation and subluxation happens only in the joint. It does not happen anywhere. So I hope you understood the difference, yeah, between fracture and dislocation, doctors. Do you have any questions on? Hello? Hello?
No, sir.
No, sir. All clear,
No
sir.
question, yeah. So fracture means problem in the bone, complete loss of integrity. Luxation or dislocation is a problem in the joint. That means what happened? Completely the articulating surface is lost. Yeah? So please try to think. Yeah. Um, I can give you one more hint for dislocation that you can make it as a note and keep it. Yeah, if you take any joint, yeah, if for an example, if you take shoulder joint, the bone that is going to get dislocated is head of the humerus. If you take elbow joint, the bone that is going to get dislocated is the radius and ulna bone. Yeah, if you take hip joint, femur is going to get dislocated, head of the femur. If you take knee joint, tibia is going to get dislocated. So what is common in all is in every joint, the bone that is more distal is the one that is going to get dislocated. Okay, doctor, so don't confuse. Yeah, in elbow joint, in elbow joint we will not have dislocation of humerus. In elbow joint there will be only dislocation of what? Radius and ulna. Only in the shoulder joint, yeah, there is dislocation of humerus. Understood, doctor? So please try to remember,
Yes, sir.
always the distal segment. Yeah, distal segment in the joint will get dislocated. So keep it. So when you can close your eyes and you can answer. If somebody gave you X-ray of shoulder joint, you know for sure if it is to talk about dislocation, it is only humerus. No other bone can get dislocated in the shoulder joint. Next, so fracture. So when we talk about bone, yeah, bone is a very strong material. Yeah, so here we can see if you put a bone vertically, especially the diaphyseal part of the bone, yeah, diaphyseal part of the bone vertically, yeah, what we can see. We can mount a car, yeah, that is approximately 110 worth. Yeah, and what happens? So and what happened? It is not going to break already, yeah, or vice versa. If you take a bone, yeah, for an example here femur, yeah, if you put a cortical, if you put a screw on a cortical layer of bone, and you can hang until what happened? 250 kgs of weight, and it's not going to break. So this shows what happened. Bone is a very strong material. So so only whenever you have a fracture, you have to put a question mark and think why this person got a fracture. Why? Because why? Um, so why we are analyzing this thing? So we are analyzing to know, is there a effective traumatic force influenced on the person so that he had a fracture, or for an example there is no influence of a traumatic force, he had a fracture. So in this case, like for an example, you fall from first floor of a building and you got a fracture, there is a traumatic force, yeah, but you fall from your own height and you have a fracture. This is called if you just slip and fall from your own height, yeah, you just simply normally walk on the street, slip from your own height and fall, there is no there is not such a big traumatizing force involved, yeah, and you got a fracture. So that time we think about pathological fracture. So we should find out why this pathological fracture happened. Yeah, maybe there is osteoporosis of different origin. Maybe it can be oncological condition that gave, maybe hormonal related, yeah, thyroid hormone maybe, yeah, or maybe it is simply vitamin D deficiency maybe. So we have to find out what is the causative agent for that pathological fracture. Yeah, one more thing, hormone, you know already, women, especially postmenopausal women, yeah, because of estrogen deficiency, yeah, they also develop also what happened, a pathological fracture, yeah, especially all this fracture happens in metaphyseal region of any bone already. Next thing that we can see over here is how to divide a bone, yeah, depending upon the structure, yeah. So if you take a bone, this is this picture, try to remember, yeah, the bone has mm, wait 1 minute. The bone has two articulating surfaces. Here there is an articulating surface, and we have articulating surface more distally. Yeah. So this part of the bone where we have articulating surface proximally and distally, yeah, and little bit of layer below that, we call them as epiphysis. So we call it as epiphysis. If it is going to be proximal, it is called proximal epiphysis. If it is going to be distal, it is called as what? Distal epiphysis. Next thing, below the epiphysis, we have a region. Yeah, in this region, we have spongy bones or spongy bones. Yeah, the bones with trabecle. We call this region metaphysis. We have proximally and distally, we have metaphysis. Next region, yeah, where we have from here to here, yeah. Inside this region, there is bone marrow canal is present. So if you are a non-vegetarian, if you eat any animal, yeah, you can find bone marrow canal. Inside that, you'll find what? Bone marrow, yeah. So that part is called as what? Diaphysis. So the diaphysis is so big, yeah, so big. So we divide the diaphysis into upper third maybe, or superior third, middle third, and lower third. So you should remember this thing. So if you take any long bone, there is epiphysis, proximal and distal. Then there is metaphysis, where we have spongy bone. Especially this metaphyseal region is the weak zone. Very frequently, the metaphyseal region, in any bone, there will be fraction. Then we have diaphysis. Yeah, this is a very strong bone. Yeah, cortical bone. Yeah, inside that we have bone marrow canal already. So I hope everybody got uh, an idea already. Yeah? If you take a bone, yeah, bone is not a cell or a tissue. Bone is an organ by itself. Yeah, why it is an organ? I'll explain you. Bone has some special function. Yeah, like it has mechanical function. Yeah, it has biochemical function. Yeah, calcium homeostasis. Yeah, and metabolism. And it has what? Bone marrow. Yeah, so you already have what? Hemopoietic function. Yeah, so bone has a bone. Apart from that, there are other functions also. Yeah, so if you don't have bone, you won't look like who you are. Yeah, everybody will be like some amoeba, or don't know what else. Yeah, like some jelly. Yeah, like how, I don't know, when you move, you'll be moving like a jelly. Yeah, so thank God. Yeah, for bones, that gives you shape. It makes you look who you are. Yeah. So why bone is not a cell or a tissue? It is an organ because it has a vascular component, reticular component, proper bone tissue, bone marrow, and cartilage. All these things makes bone as an organ itself. If you take bone and it's composed of material, it has two components: organic component and inorganic component. In this organic component, out of 30%, only 2% is living. Rest all no. So we have in the rest 98% of collagen different type, yeah, osteocalin and so on. Rest 60% of bone, yeah, that is 65 to 75. It is all minerals, hydroxyapatite, yeah, and another thing, yeah. So bone, if you take your own whole bone, yeah, uh, so the live component of the bone is only 2 out of 30%, so minimum. Yeah, so we have osteoblast, osteocyte, and osteoclast. Osteocyte is a structural and functional unit of a bone. Yeah, so osteocyte, it forms the basics of a bone. So we'll see. So if you take in a X-ray, in a histological study, a cross section of a bone, so compact bone looks like this. It is so compact. Yeah, and this is called periosteum. Yeah, that surrounds the bone. It is very thick in children, and as we grow, it becomes thin, and the cortical layer of bone become very hard. Yeah, and become the hardest bone already. So in children, as we have thick periosteum in children, yeah, they have only green stick fracture. Yeah, we'll discuss that thing. Um, if you slice a bone horizontally, when you have a horizontal section of a bone, if the bone was like this and you cut the bone horizontally, yeah, in the horizontal section you might see Haversian canals, yeah, through which flows the capillaries, yeah, that will give nourishment to the bone already. Yeah, Haversian canals, how it looks like is being given in different views. So here we have a structure, yeah, it looks like a giant, yeah, so very big eye, yeah. In the bottom it is trying to deposit something like a collagen on the bone, yeah. So this is called osteoblast, very important cell in the bones, yeah. They help in mineralization of the bone, yeah. Next we can see osteocytes, yeah. Osteocytes, I told you, structural and functional unit of a bone is osteocytes. They have like very long flagella like thing, yeah. They have a very long flagella like thing. So what is the use of this thing? So as long as the bone have osteocyte, that bone is a viable bone, yeah. uh, mm, if this osteocytes die, then what happened? This bone is already considered as a dead bone already, yeah. So here we can see much more carrier thing, yeah, like cluster. Before we saw osteoblast only one big eye. Yeah? Here we have 1, 2, 3, 4 eye, like a giant, something like that. Yeah, like cluster. Remember, either you remember osteoblast or remember osteoclast. You should remember both of them. Yeah, remember any one so that you know the function of the other. So here we see clast. Remember, like a cluster. Yeah, see underneath its thing, we see bay of absorption. It causes demineralization of bone or resorption of bone. Osteoclast function is what happened to absorb the bone. Yeah, so here we can see, yeah, bone. Yeah, osteoclast, it absorbs the bone. Yeah, so here we see bay of absorption. So osteoclast absorbs, osteoblast mineralize. So there is always a balance between the osteoblast and osteoclast function of our bone. So our bone is stronger. But what happens because of hormonal, yeah, I told you already, like for example, postmenopausal woman, yeah, hormonal imbalance, yeah, osteoclast activity is going to be very high. It will cause demineralization. The first bone to be affected is what? Our spongy bones. Spongy bones, I told you where it is. Yeah, so spongy bones, it will be the first bone to get affected. Yeah, because they have trabecules. Yeah, so it will cause fracture in this region. Yeah, so please pay attention. It will be a hint for you whenever you have trauma cycle. Yeah, try to know every bone. Where is the weak point in every bone? Let's try to see. If we take humerus, where is the weak point in the humerus, doctor? Where fracture very frequently happens? Any idea? Do you know where frequently fracture is going to happen in the humerus? Who can tell me? Anyone can tell? Hello? Which neck? Which neck? So, so it will be happening in what? In the surgical neck. Yeah, so very common. It happens in the surgical neck of the humerus. Yeah. Next thing, that is so only we have only one bone in the body that has two neck, yeah, anatomical neck and surgical neck, yeah. So surgical neck is a meeting point between uh, metaphysis, that is spongy bone, with the compact bone, diaphysis. Yeah, so it's a weak zone fracture happens. Yeah, so for an example, if you take your wrist and your hand, yeah, that is in the distal metaphysis of your forearm is a weak point. So everywhere there is a weak point. So try to know why it is called weak point. Very frequently fractures will happen in this region, so only it is called as weak point. Yeah, and what happened if fracture happened in that region? What complication happens? You should try to think and try to remember. Yeah. So here we can see how the bones are being modeled. Yeah. So here we have a horizontal section and a vertical section of a bone. Yeah. So we can see osteoblast. Yeah. What does it do? It causes demineralization. Yeah. Made a hole and went. Yeah. Then you see deposition of osteoblast. Osteoblast, what does it see? It causes what happened? It causes mineralization, forms this circles, yeah. And what happened at one phase? What happened? blast will go, and what happened in this region? What happened? You see, blood vessel, new capillaries will come here. So this is how Haversian canals are formed in the bone here, and a short and a small what happened 3D dimension of what how bones absorb and reabsorb is being schematically explained in this picture. Next, you might have a question here from where everything comes from. Yeah, so we can see already. Yeah, primitive mesenchymal cells. Yeah, it becomes pre-osteoblast. Yeah, some of them will mature to become osteoblast. What happens? Some of the pre-osteoblast will become what osteocytes already. Yeah, so hemopoietic stem cells will become pre-osteoclast, and what happened? They'll become osteoclast already. Yeah? So we can see their function, what they're doing. One is causing mineralization, another one is causing demineralization. Yeah, so this is the origin of osteoblast and osteoclast. Everything is from the marrow. Yeah, so please remember it. Yeah, so here schematic picture talks about how we see reparation of the bone tissue. So when you talk about the bone tissue, yeah, this is the resting surface of the bone. That means what happened? Everything is fine. Yeah, there is osteocytes. Everything is fine. Once the osteocytes die, what happened? Osteoclast will come and will cause reabsorption until what happened? Viable bone. Then what happened? Osteoclast disappears, osteoblast once again enters here, it causes mineralization once again to the resting surface. So periodically what happened? We have mineralization and demineralization. Yeah, so we remove the dead bone with living bone already. Yeah. So here in this picture that talks about different types of callus, especially after fracture, what type of soft bones can grow. Uh, um, between we have immature callus. If you take, this is one end of the fracture site and this is another end of the bone, yeah, where the fracture happened. Yeah, here where the bone is coming in contact with the bone, yeah, where I put the red line. Yeah, where the bone is coming in contact with the another bone, yeah, there grows this callus or the soft bone. This is called immature callus. Periosteal callus will go around above the bone, yeah, above the periosteum. So we call it as periosteal callus. Yeah. Then we hello.
Yes, sir.
Sorry, there was some interruption. So sorry. So central callus, where does this central callus grow? Yeah, central callus will grow in the bone marrow canal, and it will close the bone marrow canal. Yeah, here, if it is going to close the bone marrow canal, that we call it as central callus. Next, we have paraosseal callus. Yeah, this paraosseal callus will grow along the muscle tendons, ligaments. A calcification of muscle tendons or ligament, we call it as paraosseal callus. Understood? Hello. Clear with this understanding about different types of callus?
Yes, sir.
So
It's clear.
Yes, sir.
please try to remember them. Okay, they are very important. So these two callus is physiological. Immature callus and periosteal callus are physiological. Rest two callus is called as pathological. Central callus and paraosteal callus, they are what? Pathological type of what? Callus. Understood? Next thing. Stages of fracture healing. So when your bone breaks, how the bone is going to get healed? Yeah, so that we call it as stages, how the bones are going to get healed. So here, if you open a textbook, yeah, so here you can see the first stage. What is happening after the bone breaks? The capillaries, the Haversian canals are going to break, and what happens? There's going to be blood. Yeah.